It's the show where Hawaii's newsmakers come to talk and to take your questions live. From the nation's capital to Honolulu Hale, from the state legislature to the fifth floor. We bring the experts to you and ask them what you want to know. Spotlight Hawaii with Yanji Denise and Ryan Kalei-Suji on the digital platforms of the Honolulu Star-Advertiser.
Well, aloha, and thanks for joining us on this Monday morning. Great to see so many of you already tuning in here. This is Spotlight Hawaii on the digital platforms of the Honolulu Star-Advertiser. I'm Ryan Kalei-Suji, joined by Yanji Denise. And Yanji, this morning we catch up with a familiar guest who's been on this program a few times.
Just a few. We're heading over to the Hawaii State Capitol, straight to the fifth floor to talk to Governor Josh Green, a frequent guest on this program, and someone who I'd imagine is quite busy right now. Good morning, Governor.
Good morning. Thanks for having me.
So we are in crunch time at the legislature. How do you feel the session has shaped up overall? And tell us what your week is, what you have planned this week.
Well, it's been an exciting ride. I'm very grateful that we've gotten through our conflicts. So since we've last spoken, most, if not all of our nominees have gotten through the process. So now we have a cabinet in place. The last few votes will be held in this last 7 or 8 days of their session. So that's a good thing. It makes it easier for me to do the job. Overall, I feel very good, but there will be a lot of decisions made in the next, say, even 2 or 3 days. The leaders of the Ways and Means Committee and the Finance Committee are meeting as we speak to finalize the budget, and that will determine ultimately how much support we have for our Alice families, whether or not we have adequate support to pay off the debt for social workers and nurses and doctors to be in Hawaii that we need. Of course, the ratification of the teachers contract, which I finished the negotiation off last Friday with great support from all sides. All these things have to be kind of sewn up, and I expect that they will. I'm optimistic, but a lot of the results for this session will depend on what happens this week.
And if you can just take us through like those conversations that you're actually having with leadership. Are you meeting with the WAM chairs and finance chairs regularly? Are you talking to the leaderships in both houses? If you can explain how updated you are, so you know moving forward how much money your programs and your initiatives are going to get supported.
Yes, parts of our team and I are constantly in communication, weekdays, weekends, morning, noon, and night at different levels. So I, of course, see the Speaker and the Senate President with extreme frequency, also have been meeting with the Ways and Means Chair and the Finance Chair, and then I have my policy team that does the same. It looks good for most of these things. Look, we're all in agreement that we have to deal with the cost of living for our local residents. There are 2 bills. One's number is 954. That's the tax kind of structure or restructure of what we're doing, earned income tax credits and raising the standard deduction. That will help everybody, particularly people who are in the month-to-month or week-to-week category of survival in Hawaii. That's critical. Then there's some tax credits in Bill 1049. Those are more like child-dependent tax credits. So if you're sending your children to preschool or if you have adult daycare for family members, you can get some help and support. All these things are critically important. I expect that we will see some success there. But ultimately, the legislative process has to play out. I do think we're going to see significant resources for, like I said, the tax package. We proposed about $315 million in tax breaks for Alice families. It's necessary. If people want to be able to afford Hawaii, we have to have that. Beyond that, the teachers contract is a very big deal. That was a $577 million 4-year deal to make sure that teachers can stay in Hawaii and that we raise the salaries of the teachers at the entry level up from $38,000 to about $50,000 per year. That means we can recruit teachers for our keiki. So that was a big deal. So I'm restructuring a lot of society with the help of the legislature right before people's very eyes. So education's getting restructured. Healthcare will be restructured with what looks like about $19 million in loan forgiveness. Hopefully they'll fully fund that so that we have enough healthcare for our people. And really, there's some other big pieces of change that we're pushing, mostly on homelessness and housing. But the proof will be in the pudding over the next couple days. I'm told that they're much closer than they were just a couple days ago. Remember, this is the first time that Senator Dela Cruz and Representative Yamashita, both the chairs of those committees, are directly opposite one another as chairs because Sylvia Luke, my lieutenant governor, became lieutenant governor, and she had been the finance chair. So this is their first opportunity to work together. But they know our priorities, and they know what we all need, which is help with housing, homelessness, and affordability.
One thing that you mentioned off the top was that you have a functioning cabinet now. One, of course, name that we don't know yet is who will be your chosen DBED director. Can you tell us a little bit about how you felt that nomination process went and who you're looking for or what qualities you're looking for in the person that you're going to be naming? You're free to name him or her as well this morning.
Yes, and I would, but out of respect to Chris Sadayasu, who I really have a fondness for, we want him to be able to finish out the last 10 days of his tenure. He's been working hard on the stadium issue, which we can touch on in a minute if you'd like. I want to respect him, and therefore we're going to wait till the day after the session to announce our new DBED director. It was already past the deadline to have that person taken up for confirmation, so I'm waiting there. I will tell you this. I have already spoken with the relevant chairs, and they appreciate this individual and support him or her. So that's a good situation in the Senate. Just so everyone understands how this works, I'll be nominating judges as we go. There'll be 2 Supreme Court justices that I have to nominate sometime in the not too distant future. But even when the Senate comes back to take up those nominations, they don't take up the interim cabinet members. They wait until the next year, just based on how the law is, unless there's a special session. So the people that we put in for the Office of Planning and for the DBED position will be held over until next January. But I do intend to put people in there that can work well with the legislature. So I don't want any further conflict if we can avoid it. I think it was a healthy bit of battling, and it helps us be stronger. We're a sharper team when they press us on questions. Fortunately, 90% of our people got through, which is a good thing.
You mentioned Aloha Stadium, so let's go ahead and dive right into that. Of course, this is one of the larger projects that has been on front of mind for many this legislative session. A lot of it has been tracked closely as to how this project will move forward. At this point in time right now, what are those conversations like between the lawmakers who are involved in that process, as well as DBED, because we know that they will also play a significant role. What can you tell us about the future and where things stand right now?
So the future is we'll build a stadium. I have to wait until they tell me whether I have the additional $49.5 million to build it. So it's either going to be a $350 million stadium project or a $399.5 million stadium project. I have put together a coalition, so it won't just be DBED and it won't just be the university. We'll have a consortium that manages the contract. It will be design, build, operate, and maintain. And if we only have the $350 million, I'll go forward with simply one RFP to allow for the development. I'll try to loop in the county as we go forward to pay for infrastructure, but that is the way we will go forward. I really want to make sure that we give the legislature the breathing room to make that decision on that other $49.5 million. It will ultimately determine how many seats we have. My goal is no matter what to have 25,000 seats, and I'm pretty optimistic about that because if someone is developing the land around that for housing, which is critically important, and building us a $350 million stadium, they'll be able to put in additional resources, which they will be able to benefit from because they'll be managing all the events with the exceptions of the football games for our own university. So it's really something that I would have liked to do 2 or 3 months ago, but I have to respect the legislative process and I need to know whether or not I have that extra resource.
What is your timeline looking like for that? I think a lot of people, before this project has even started, are concerned that the stadium will go the way of rail when we think about time frame and also the budget. So how do we ensure that that does not happen in this case? And when are you actually hoping to, start the process of having folks, when can UH play games at Aloha Stadium?
So they can play them in 2028, I'm almost sure. The way we are protecting ourselves against it going way over cost is that we will not be allowing private finance to be a part of it. So it's going to be simply a max out of the appropriation of $350 million or $399.5 million, depending what the legislators decide. That's it. That's all the money that will be allowed to go into the project. If there are naming rights revenues that come in, which there will be, that will also go towards building more seats, boxes, and so on for the stadium. And of course, whatever revenue comes from the surrounding development will be able to be invested in the stadium district. But we're going to cap it with that number. And that was the prerogative of the legislative leadership. And I really like that because I did not want to see us go over. one way to look at it is if we had allowed for the finance mechanism, it's kind of like putting the stadium on a credit card in a way and paying lots of costs. They were called availability payments over time. We're not going to be doing that. There was some question as to whether or not that was acceptable legally. So we're going to keep it simpler. But, I know people are eager to get this thing going. So it's going to take that appropriation. We will have to demolish the stadium with those monies, the current one, and then we'll begin to rebuild.
One of the headlines in the Honolulu Star-Advertiser today concerning the face of the Hawaii Tourism Authority. There are a number of discussions and debate, including measures and bills in the legislature right now that would actually defund the Hawaii Tourism Authority and cancel this organization. Your thoughts about what the future of HTA should be? We've spoken to many tourism officials on this program who have expressed their support of HTA and its leadership and the need for it here in Hawaii. What do you think should be done with the HTA moving forward, and your reaction to what lawmakers are considering?
Well, again, I defer to what the lawmakers decide ultimately for policy purposes. We do need to manage tourism. And that was signature to what, I always said as we were running and what I believe in now. So the management of tourism is the most important thing, although you don't want to be out-marketed by other areas. You don't want to be out-marketed by the Caribbean or Mexico. That's somewhat important. We have already submitted an RFP for the management and marketing contract, $38 million for marketing, $29 million for management. And I hope that will be fully funded because that's our commitment. But going forward, we're going to have so much attention on Hawaii, it's actually almost hard to fathom. We're looking at a major event in June of 2024, which is FestPac, the Festival of the Pacific, when the whole world will be watching and we'll be highlighting Hawaii. So there's so many things that will bring positive attention to our state in the coming years. I'm not personally worried that people will forget about Hawaii and the majesty of our beautiful environment. But, you want to be professional about things. If they do disband HTA, we will form an advisory commission underneath the DBED director. That's what would happen. If they, however, feel that it's okay to go forward and just amend it, then we'll also make sure that we have a good director there to be supportive. I want to, thank all the people like DeFries has been, a really hardworking guy, cares deeply about Hawaii. Some people support him, others don't. That's not for me to discuss. What I'm here to say is we have to support kind of our vision for Hawaii, and it's mostly management of the 10 million people that come every year.
It sounds to me, though, that you don't think that HTA in its current structure is critical to Hawaii's tourism, to a healthy and vibrant tourism economy here. Is that correct? It sounds like you could kind of go either way.
I can go either way because I know I can put good professionals in DBED on this issue. And I know that I can also contract with the private sector to make sure we're well represented globally. I'm not too worried about that. Historically, the HTA was set up so that some governors didn't have too much influence over kind of the entire spectrum of tourism. And so HTA has been a buffer for a long time. I'm not sure you need a buffer because I'm just going to ask good people to do professional work. And as everyone knows, I'm very focused on tourism management, which is the way that we want to go. And so we've had a lot of good leadership from the Hawaiian community focusing on re-emphasizing the true heart of Hawaii and its tourism, which should include the Hawaiian culture. So I'm positive and feeling good about where we're going psychologically for our state. As to the management, again, it's not my place to meddle with the legislature. I'm not sure people realize that I meant that when I said it over these years. I don't try to micromanage bills. I'm looking at the bigger picture. We need tax breaks for people who are essentially food insecure and housing insecure. We needed to have a good teacher's contract so we could educate our kids. We have to have enough nurses here to take care of people when they're in the hospital. Those are the fundamentals. The rest of the things are really left to the legislature to make minor or modest adjustments.
Well, one of the areas that you had talked about when we talk about sustainable tourism is this green fee, and there have been different variations that have gone through the legislature and are currently moving forward. We, at this point in time, it's difficult to say what is ultimately going to be the end result. But in your discussion with lawmakers, how do you think that this proposal that you had put forth is going to fare this legislative session?
I think that's probably the one bill that has the most difficulty for people to wrap their minds around. at the legislature right now. It's a big change. Anything that we're the first in the country to do always causes some concern. They are setting aside a lot of resource, which I asked for, $100 million to manage climate change and the impact of climate change. I'm not sure they're going to be ready to give me full authorization on a climate impact fee or a green fee. We already do have some, as you know, some destinations in the state that, charge fees. And I think ultimately it should be somewhere around 20 sites, and it should be a single license. That's where they're headed. But they may just ask us to do a work group or a task force going into next year to finalize that. Look, that's okay. All things being equal, I'm glad to have resources for environmental protection. That was our main ask. It would be better if we started sooner, because the sooner we get this green fee going, the sooner we'll have resources and we won't have to rely on our own tax dollars to manage things. But I don't think we can do everything in one session. That's why I'm really focused on the GAP plan. That's our tax plan, the healthcare package, and the homeless package.
Yeah, let's drill down a little bit on homelessness. I'd love for you to share with our audience a little bit of what we've been hearing about that's going to happen right by Queens, this idea of a medical respite kauhale. We've heard the term kauhale, I think, tossed around in the last few months than we ever heard in the past. This is a different kind of kauhale. Can you explain to people what you're hoping happens there?
Yes. So as people know, individuals who are homeless go into the hospital. 30% of all emergency room visits are made up of visits by the homeless community. They suffer greatly, and then they're back on the street, sometimes on the curb late at night. I want to say this: it's going to be medical respite, a very tiny kauhale, about 10 units, and then social work, security, and some hygiene right there, because people have severe wounds. Can't go back to the street. They end up back in the hospital, costing tens of thousands of dollars every single admission. And can I be blunt with you? I was deeply offended by the commentary that appeared in editorial from one of the civil beat writers, DeGracia, I believe, when he said it's a bad idea to care for people in the urban core. Well, where in the hell do you think people who are homeless live? In the urban core. That's where a lot of people are, and they are struggling, they're suffering. We have to make sure it's safer for those around them, and that's why you do these things. You have to go to where people are, and anyone who understands the challenges with homelessness knows that these are individuals who are struggling terribly, who have to go where there's water, where there's hygiene, where there's some resource. And that's why individuals all across the country end up in urban centers and in the urban core. And if you're not willing to help people where they are, you're not willing to help people in society in general. So that was a deeply uninformed commentary. And I will tell you, we have to be better. We have to be better than that. I'm literally building this tiny kauhale, which is medical respite, in my backyard. It's right in the area right next to the governor's residence and at the Department of Health, where we have a lot of resources, so that you don't see an individual with a terrible fracture back on the street or with an open wound, which is not healthy. So we have to be better than that. And we have to be true to our values, which is that we care for everyone. Now, we will eventually have many kauhales spread all across the state. But if it can't be done in my backyard, then how can I ask our citizens to put it in their backyards? And so that's where I'm coming from. That will save us a lot of suffering, a lot of resource. And we have to be open to the reality that we have a high number of people who are homeless in our state because they can survive in the climate. We'll do all that we can to help people, but I'll tell you, we should never turn our backs on anyone, anywhere. And that's why you're hearing me talk about the foundational changes that we have to have in Hawaii for education and taxes, and then the moral changes that we have to have, which is that we're not leaving people out of all structure and out of all support. So there's a lot that's there, but we'll have this kauhale sometime in the next month, it looks like. And I want people across the country to know that we are the most kind and most civilized state that exists. And we're going to export these ideas. In fact, I'll be doing that in Los Angeles with a series of national leaders in conversation, so that they see that they can also solve these problems. If Hawaii can't do things in a civilized way with the spirit of aloha, I'm not sure any other state can. Forgive that diatribe, but it's really important that we care for those who are suffering.
Well, let's dive a little bit more into the details here. We know that there are other kauhale projects that you have worked on that have been, supported by the private sector and funded by that sector as well. How will this project be funded moving forward? And what is it looking like in terms of the numbers of, is it actual houses? You talked about a respite center. Is that a separate center that will also be on the premises? If you can paint that picture a little clearer of what it will look like.
Yes, 8 to 10 tiny houses, very small, treated like a village, with support services and social workers on the site, and a hygiene center. I believe will very likely use the people that did Project Vision, who are extraordinary and caring, to have a shower and a bathroom. You know, it's a heck of a lot better than people using the public grass as a bathroom or not having a place to get clean. And then security in the area, which already I met with all the law enforcement folks from around the region, and they were very concerned. So this provides more control. You don't think I'd put it in my backyard if I didn't think it could be safe, right? So that's important. That's what it will look like. The resources come from resources that we have from historic Kauhale appropriations and Ohana Zone appropriations. I'm really proud of the legislature. They appear poised to reinvigorate these funding mechanisms. So we're going to have Kauhale and Ohana Zone monies. And these are safe zones, but also not just safe for the individuals who are homeless, but safe for the public so that you don't have people drifting. And if there are people doing bad behaviors, let me remind people, we'll arrest them. If people are dealing drugs or are violent, we don't tolerate that. But there are a lot of people suffering. And so this is one of many Kauhale. You'll also see something towards Middle Street. We have 25 locations designated. I would, in general, like to defer to James Koshiba, our homeless coordinator, and Nani Medeiros, our housing coordinator, to talk about the specific, ultimate locations. But there's got to be a lot of them in the urban region so that, once again, it doesn't overwhelm any one street or block or community.
You and your deputies, apologies, we're still learning how to unmute. You and your deputies are going to have to go out and make these pitches to neighborhoods to accept these Kauhale in their communities. Tell us a little bit about what those conversations, what you anticipate that pitch will be like, because I think a lot of people feel like, I don't want to see homeless folks, but I don't necessarily want to see Kauhale either. That might sound harsh, but I think that's the reality of those conversations. So tell us about what that pitch is and how you kind of change that attitude.
It's not a pitch. It is a reality. There are homeless in all of our communities, and we're going to have Kauhale available in each community, but very carefully managed and carefully structured, like you see in other cities. You have to have something in each region. Otherwise, it overwhelms one region. Now, there's always going to be more need in the urban core because that's where most people find themselves. You'll see expanded services in places we already have them. For instance, in Ivalai, we're working with the city and county who have been very good. We appreciate Mayor Blanchiardi so much. We also are very fond of Dr. Ireland, who's doing good work with core and medical respite. Places where there already are those services, we're going to expand them. But we'll go out to each community. There'll be opportunities in town hall meetings to obviously talk about where these projects should be. The neighbor islands want them very badly because in each and every community that we've got, there's people drifting into the streets and sleeping on people's doorsteps. In business communities, they're on kind of the eaves of people's offices. It's better to have a parking lot devoted with some houses or an open lot that is fenced in and is protected, rather than having a large number of people spread out. It's just better that way. So ultimately, it's my job to actually take executive leadership and do the work that people have been asking for a long time. It's not a mystery as to whether or not this problem continues to linger. It's there. It's right there in front of us every day. And so having actual services is better. So I'm not going to let people reject projects. We're going to try this for a few years to make sure that we actually help people and we decrease costs by a lot so we can reinvest it in, mainstream housing. There's a lot of work to do. But there's been a movement in the country where they say, not in my backyard. We're just not going to do that in Hawaii. That's not acceptable.
I want to bring in a question from Heidi, who's asking a specific question. Can Kauhale be placed in underutilized school campuses and where there are also buildings for additional resources? What other mechanisms or areas would you be considering beyond just some of these? I know that you said you have identified some areas, but could they include underutilized state property right now or other buildings, as Heidi mentioned? What are the other variations of what this could look like, or is there?
Absolutely. So state facilities that can be consolidated so we can focus all of our resources in one building would be a go. That's easy for us to do. Parts of the Department of Health area, the campus right there is really amenable to helping. And there are a lot of healthcare workers right there also. So that's why it's such a good place. Beyond that, though, I have looked at schools over the years. Unless a school was completely decommissioned, it's difficult to utilize the facilities because you don't want to put children, in any harm's way ever. And children would be around singularly homeless individuals that are having problems with addiction, perhaps mental illness. We will be looking at some additional respite and kind of Cal Holiday-like areas. For example, for just plain medical respite when people have been homeless, we're looking at Lehigh Hospital and a wing there. There are other facilities that would like to step up, particularly in Evalay, where we can do a lot of beds. But schools would have to be, if they were decommissioned or no longer going to be used and students were going to be relocated to a different school, then we can dive in. Remember, it's difficult to relocate people because they just leave. And I want this to be actually workable.
There are a number of comments this morning about COVID, and I just wanted to see if you could briefly, we're almost out of time, but if you could briefly address COVID-19. We see every week there are still plenty of cases in our community and a number of deaths. So the FDA and CDC have approved boosters for people who are over 65 or immunocompromised, a bivalent booster. Just how do you feel the state is doing when it comes to combating COVID and any messaging about vaccinations?
We're doing well. The people that have been hospitalized have been more elderly. So I was told a week ago that all of the patients that were hospitalized were 69 years old or older. We do recommend people get a bivalent vaccination if it's been more than 4 months, or if they're 65 years old or older, it's good to have that shot. Now, the hospitalizations have been, for the last 5 weeks, 56 people in the hospital, went up to 69, down to 52, up to 72, and as of this morning, back at 65. So even as governor, I'm watching this every day and every week personally. So it's been very flat. Like I said, 65 people in the hospital total, 6 individuals in the intensive care unit statewide. We peaked at 393, I'll remind people, when we had the Delta variant long ago. So this is like 85% lower than the peak. It's not right now a problem that's overwhelming our healthcare system. So I don't want people to panic. I just want people to be sensible. If you're at higher risk, as always with any virus, we welcome good precaution. Wear a mask if you're worried. Get your vaccination booster if you're eligible. Those are very good things to do. But we do not have a surge in our hospitals like we had before.
We are almost out of time, but want to provide you a final thought this morning. Of course, as we mentioned, it is crunch time at the legislature. Your final message as you head into this home stretch of the legislative session and working with lawmakers, and then ultimately taking on the budget that they present and approve for you moving forward.
Yes. Well, I'm, like I said, very thankful to the work that we've done together. I appreciate them. Contrary to what people might have read periodically in the newspaper, we don't have that many conflicts, but they have to exercise their legislative prerogative, and they did that with a few of our nominees, I think 3. Our team is mostly in place now. As long as we see significant tax reform for ALICE families, those who are really struggling week to week and month to month, as long as we see that, housing monies, and we help reform our healthcare system, which we have a lot of resources going in to attract nurses, social workers, and doctors, we're going to be fine. There will be a large appropriation for housing, and we'll use emergency rules when necessary to make it easier to build housing. Overall, we are making really large changes in how we approach people in the state of Hawaii. Every day, I wake up and remind our team to be caring of individuals. There are other issues that are out there that we're going to troubleshoot throughout the days and weeks. On the neighbor islands, they're worried about protecting Nene, but also being mindful and respectful in a kind of humane way for cats and other animals. We're going to try to work through those issues carefully. And I'm sending our DLNR director to Big Island tomorrow to work out a peaceful solution. We're doing other things that are just meant to be fun and socialize and raise money, for example, for the food bank. My team did a great job cooking chili. I was cooking chili all day yesterday because we're raising money for the food bank. So if people want to come over to the state capitol today on the 5th floor, come and get a chili dog, and we'll help people who are food insecure by giving that money to the food bank. So we're trying to demonstrate a deeply caring position for the people of Hawaii. Jamie and I have been much more available. We've already had about 25 events over at Washington Place in the first 160 days. So again, we want to welcome people to see what government is like, but mostly we want to give back to people who are struggling. And that's what I think you're going to see come out of the legislature. That's definitely our agenda. And this session has been a very good one, provided this is a good week and we get good results out of the House and Senate.
I got to ask you this because you did bring it up, and we've gotten so many comments this morning. I know it's 11 o'clock, but we'll be real quick. Michael Smith saying, please ask about the Queens Marketplace at Waikoloa Beach that he has promised action on today. There are a ton of comments this morning about what's happening with cats there. I know that's a very specific issue. A lot of people on Oahu may not be familiar, but just briefly, if you could address the people who are concerned about some of the mitigation measures in that area.
Yeah, so I've asked the director to not fine or apply those fines to anyone who were cited. So that will be taken care of. Also, we're going to try to find a humane way to get some food and water in a very controlled way so that cats don't suffer. But I do need to remind people that feral cats really overall shouldn't be fed. They are an invasive species, and we are protecting nene, which are very dear to us. That is our state bird, and they're endangered. So we have federal laws that basically tell us you cannot endanger the nene. And that is something that we have no control over. But I do want to always protect the goose, our native goose. Having said that, these are the hour-to-hour and day-to-day kind of challenges we have. There are people who are very passionate personally about different issues. Now, we're spending most of our time right now focusing on food insecurity for children. And that is, very important. In fact, more important than anything else we do. So I try to avoid these brush-ups where people may be passionate, but we don't want to divide ourselves in society. But I am going to have the director of DLNR, chair rather, go over there and try to broker a peace. I have spoken with the Humane Society. There are ways to protect the nene that can also probably avoid making any cats suffer. As you know, my focus is to protect the people of Hawaii and to make sure that we don't lose our children to the mainland. And so my main focus is going to be on our economy, our tax system, and housing.
All right, Governor Green, thank you for going overtime with us this morning and addressing a number of issues. And we always appreciate the time that you spend with us and the updates you provide. We'll see you back here in a month.
Sounds great. Thank you.
Aloha.
Aloha. Thanks, everyone, for sticking around. I know we went a little over, but we had to ask the cat question because there were just, Ryan, so many comments as we see people really fired up about that issue. The governor really has to address so many issues, and we covered a lot of them in our conversation today. Particularly interesting, I thought, were his comments about the Hawaii Tourism Authority and really saying that he could go either way on that if they are fully funded, that of course he supports that organization. But if for some reason the legislature decides to take it in another direction, and we know John DeFries has been holding press conferences, the HTA really in the fight of their lives over there, the governor's saying that the DBED will be able to handle it, and he will appoint the right people to both manage and market tourism.
Yeah, but speaking of DBED, that is a position that he continues to await to announce who he will nominate to lead that department. Of course, there has been some pushback on his other nominees for that position, but saying that he's going to respect the lawmakers' process right now, wait to the end of the legislative session before announcing who he is nominating to lead DBED, who would oversee much of the conversations that's happening surrounding tourism and HTA, as well as Aloha Stadium. Saying that he's also waiting for lawmakers to present in their final version of the budget just how much money will be allocated for the stadium, which will determine the size, the overall scope, but confident moving forward that he has a team in place and an action plan in place that will help the stadium be built and not to allow this to become another rail timeline or something that will draw some negative pushback from members in the community.
That's right. And he says he hopes that the team will be able to play there. The UH team will be able to play there in 2028. So we will be watching that timeline as well and seeing what happens with the legislature and how they decide to move forward. It sounds like the governor is optimistic that he's going to get what he wants in his priorities when it comes to tax cuts and putting more credits into the pockets of working families when it comes to funding things like childcare, adult daycare, and just general tax cuts to the lower income folks folks in our community. That's something that he's very optimistic on and seems very happy about. Also talking a lot about the homeless issue and some of the plans he has. That Kauhale Respite Center across the street from Queens sounds very interesting, right next to the Department of Health, right behind the governor's residence, putting in 8 to 10 small units to help people who have been discharged from Queens and maybe don't have somewhere to go. If you've driven by the hospital, basically any day of the week, you do see people who are clearly, under-resourced and have just been discharged and have nowhere to go. And this would be somewhere in between. He's saying that he's going to put it in his own backyard so that when he makes the pitch statewide, that the community will be more receptive for the same.
Yeah, and looking at other locations, he said that already have been identified, but looking to expand in different communities beyond just the urban core, but recognizing that this is an issue and a statewide issue and something that is not confined just to downtown Honolulu and areas as such. So a lot that we covered. If you miss any portion of this, we encourage you to go and watch it back later this evening on Channel 50. We also have this as a podcast wherever you consume your podcasts. Different shows, be sure to download that, or this will be on the digital platforms of the Honolulu Star-Advertiser as well. On Wednesday, we focus in on the environment.
Yeah, very interesting. In March, President Biden announced that his administration will increase protections to the Pacific remote islands. That is creating basically a brand new national marine sanctuary. That's not yet been approved, but it is something that the president is supporting. We are going to be talking to folks from the Pacific Remote Island Coalition. This region is very important, both environmentally and it has tremendous cultural significance as well to the peoples of Polynesia. So we're going to be diving deep into that. It should be a very interesting conversation, the start of what I'm sure we'll be hearing a lot more of over the coming years. So join us for that conversation right here on Wednesday at 10:30.
We'll see you then. Aloha.